Approximately 1 year ago, the Integrated Health Network was rolled out in our community, and we started doing the health improvement plans. It was supposed to be part of what we're doing with our clients. And I started to use it with my assisted living clients. And I can't use it with all of my clients, but certainly those that are willing to use it and those that have the capability, I was using it. Last year is when I started, and this year, as it was getting later in the year, I was coming around to redoing my assessments, and I was getting to the point where I was starting to meet the clients again that I did health improvement plans on. So, made an appointment, and I was walking into his suite. I saw sitting on his computer desk his health improvement plan. And I went, oh, this is neat to see. So I casually said as I'm walking by, oh, I see you've got your plan here. And he said, well, yeah, we're going to talk about it, aren't we? And I said, oh, yes, we will. So I opened up my computer and we exchanged a few niceties, and I started in on the assessment. And I had his plan sitting just beside me, and as I was going through the different area, I would refer to the plan and I say, so how is this working for you? And he said, well, I've done this, and this is what I've done. So I provided some positive feedback for him. We got on to the next section again, and I said, oh, okay, we've done some talking about this, and you did a plan on this. How did this go? And he said, well, I've done this. So again, I provided positive feedback, and as we were going through this assessment and looking at the care plan, I could see that he was getting, he was holding his head up higher, he had a bigger smile, and I could see that he was quite excited and almost proud of himself. We got to another section, and he's a diabetic, and one of his goals was he was going to work really hard on self-monitoring his blood glucose levels and actually do them quite regularly. So I said, well, how's that going? And with incredible excitement, he wheeled his wheelchair around, and he took it to an area in his kitchen, pulled out this logbook and brought it to me. He stayed within the parameters that he'd set for himself, and he was really proud of this. He had taken ownership for it, and he had it visible to him at all times. And with this plan being visible, it was clear it was important to him, and he placed a lot of value on this plan. And it was a part of his life, and he was integrating it on a daily basis. So we'd gone through most of it. He had met or he had exceeded actually each goal that he'd set for himself, with the exception of one goal. And I touched on it briefly as we were doing the assessment, and he didn't want to talk about it. So we finished it, and I said, so what do we want to do this year? And he looked at me, and I said, what do you think if we go back to that goal that you kind of had difficulty with? And he said, So we talked about it a bit more, and it was clear then that there was a few barriers. So we started to break the barriers down, and one of the biggest barriers was he was afraid. He was afraid to tackle this goal that he had set for himself. So I said, well, can I help you with that? Can we get rid of that fear? So he told me what his fear was. One of which was he didn't know who he should call, he didn't know a telephone number, and he didn't know what to say. So I had my little handy book. I pulled out the telephone number, and I said, well, let's kind of do a little bit of a session where we talk about what are you going to say. So we did a bit of a coaching session where I gave him some ideas, and I gave him some suggestions of what he could say. So he said, okay, let's do that. So I did another plan for him. And the exciting thing was I left feeling that I was very confident and he was going to be able to follow through with this. 6 days later, he called me on the telephone, and he said, so I've made an appointment. I said exactly what we talked about, and they've accepted me, and my appointment is for, and he told me the date. And he said, as soon as I finish with the appointment, he says, I'm going to call you and I'll tell you what's happened. I was excited for him. He was motivated, but through this experience, I believe he felt more confident that he could tackle goals in his life. As I was reflecting actually later, I recognized that he was at the point in his life where he could take control, make something happen. And I felt with the positive reinforcement, he felt very empowered so that he could continue to make positive changes in his life.